Hello, Cassie Miller here. I'm the feeding and swallowing clinician and speech language pathologist for the WVU Center for Excellence in Disabilities Feeding and Swallowing Clinic. Our clinic is housed in Morgantown, but we also offer telemedicine services for families who find remote services more accessible. Here at our clinic, we conduct evidence-based interdisciplinary assessments. In addition to myself as the speech language pathologist, our team also includes a dietitian, a social worker, an occupational therapist, and a behavioral psychologist who is also a BCBA or board certified behavior analyst. So when families come for an evaluation or when we visit a family via telehealth in their homes, we look at many different things with the kiddo. We look at their eating, we look at the behaviors before and after eating, we look at what they're eating, how they're eating it, and kind of the family dynamics surrounding meal times. After we do a thorough assessment for the child, then we meet together as a team and develop a family-centered plan. That plan is developed with the family in mind, so we can make really family-friendly recommendations that will help the family and the child feel successful and see success as quickly as possible. Oftentimes, we also collaborate with other agencies or therapists who may already be involved in the child's life, or we bring in new people to provide more support for the family. We also do follow-ups, which can be intermittent. Sometimes we see families in quick succession a couple of times until they're ready to kind of take off on their own. So who do we see in our clinic? There are some diagnoses that are often associated with feeding and swallowing difficulties. That can be children on the autism spectrum, children who are very premature, or children who are using a G-tube for nutrition. In addition to that, sometimes you can see some red flags in the development of children. And if you see one or more of these red flags, you can make a referral to our clinic and we can take a closer look. Those might include long meals that take more than 30 minutes, difficulty with a child transitioning from one milestone to another. So they might be 2 or 3 years old and still only having success with a bottle. Skill regression. So a kiddo may have been able to use a spoon, eat a big variety of foods, or tolerate table food, and now they're no longer able to do that. If a kiddo doesn't accept any table foods by 12 months and they're not having any success with a spoon by 9 months, that's a red flag for us. Any coughing, choking, or gagging that's consistently seen during meal times is a concern for us as well. Vomiting or spitting during meals is a concern. A really limited diet variety. So these are our kiddos who only eat, a couple things, 1 or 2 things, or just a few things from each food group, or they may eliminate entire food groups completely. Poor growth. This can be weight. This can be just limited growth overall. As far as height goes, our dietitian can help support assessing growth and looking at the trajectory of growth and what our expectations there should be. So if you see any of these red flags, if you have a family that's expressing concern with feeding and swallowing, then we are more than happy to take a closer look. What's the referral process for our clinic? Anyone can make a referral. We get referrals from physicians. We get referrals from families, from teachers, from therapists. And there's no fee for our clinic. We are grant-based, so we don't have to manage insurance or anything like that. So you can just contact us, make a referral. The family will get an intake packet. So once the family fills out that packet, we'll get medical clearance from their medical provider, and then we'll schedule the family for their appointment. We do often have a wait list, so it's important if you have a family who may want our services to go ahead and get that referral process going so that they don't have to wait a long time. If you'd like to contact us for more information, or if you have a referral for the WVU CED Feeding and Swallowing Clinic, you can contact us via our website, phone, or email, and you can see those listed there. Thank you so much, and please let us know if you have any questions.